Hi, I'm Dr. Riggins, and I've been a partner here at K4I Associates for more than 25 years. In my former life in the Army, I started the Army's refractive surgery program. That was almost 30 years ago now. My protocol patients were the Delta guys, so as you can imagine, they were pretty picky. And so I've been getting questions about refractive surgery now for 30 years. So I'm going to give you the top 5 questions. So question number 1, am I a good candidate for LASIK or PRK? Well, that can be kind of a tricky question, but in general, here's the answer. If you wear glasses or contacts all the time so that you can drive a car or see the television, you're probably a good candidate for refractive surgery. There's some very specific data that we have to get together, like the thickness of your cornea, that's the clear part on the front of your eye that you look through, and also the magnitude of your error, like how big the error is. There are some folks whose errors are so large that refractive surgery of the laser type might not be the best answer for you. Also, age can play a factor. If you're under 18 and your glasses prescription isn't stable, then you're really not a good candidate because you need to be over 18 and have a stable prescription. Also, as you get older, if you are moving into the years where you may be developing a cataract, then sometimes the better thing to do is to look at our options for cataract surgery and the things that we can do for that. That might be a better answer. Question number 2, what's the difference between PRK and LASIK? Well, the difference is in the way that we do the surgery so that we can do the refractive correction. In PRK, we're going to remove the epithelium on the surface of the cornea. Again, that's the clear part that you look through. That's the part that we have to reshape. LASIK, we actually use a device, a laser, that allows us to make a flap. So think of something like a trap door. So we make a flap and we lift the trap door, shoot the laser reshapes the cornea, and we put the flap back down, or sort of close the trap door. So the third question I get is, when can I resume normal activity? And to be honest, it sort of depends on what your normal activity is. If you're a kickboxer, well, I'm going to be a little less enthusiastic about you resuming normal activity than if you're a desk worker. But in general, it works like this. With LASIK, where we make the flap, shoot the laser, put the flap back down, I typically won't restrict my patients the day after and any day following that. Some of my colleagues do restrict their patients a bit more than that, so it's going to depend a bit on the individual practitioner. Questions that I get asked is, does LASIK hurt? Does PRK hurt? And the answer is no. But there is a distinction between the two treatments that I talked about earlier that's important. When we do PRK, your eye is numb, and when we do the epithelial removal, we move straight to the laser treatment. You get a soft contact lens, and you head home. With LASIK, it's a 2-step process. We're going to make the flap first, and then you move to the refractive laser. We lift the flap, obviously an eye at a time, and do the laser treatment. During the flap formation, the eye is compressed to allow us to get a perfect flap, which is done with the laser in a very elegant program. But during that step, the eye is pressurized, so it's common that people will feel a sense of pressure. Oddly, some people don't feel it at all, and other folks feel a sense of pressure. But it's just during the formation of the flap, and most people find that it's really easy to tolerate. So that's essentially the difference between those two techniques. Another question I often get is, will I have 20/20 vision? And this goes all the way back to the days when I was working in the Army doing refractive surgery. And the answer that we know from data is that a great many, the overwhelming majority of patients will have 20/20 vision. If you look at them 3 months after their refractive surgery, a great many will have 20/20. Interesting, in the last 30 years, the number of people that achieve 20/20 is greater than it once was because the algorithms for how the laser works have improved and are more sophisticated. The technology we have right now in our clinic is more sophisticated than the technology, certainly, than we had when I started doing refractive surgery in the Army. That said, we're not lasering titanium, right? We're lasering organic matter. We're lasering tissue that heals and changes. So some people will drift a little bit after the treatment, or some people might not be precisely on the money, and there's some chance that we would do an enhancement procedure 6 months or a year later. That happens. But if you look at the overall data, in cases now, the data is that 95% or so, depending on the study, achieve 20/20 vision after a laser refractive surgery. Kind of more interesting, not to get in the weeds too much, there are some people whose best corrected visual acuity actually improves after laser, and their corrected visual acuity after laser is better than the vision that they had with glasses or contacts. It is very uncommon in terms of percents that anybody loses best corrected visual acuity after refractive surgery. Okay, well, that's the top 5 questions that we get. I'm Dr. Wayne Riggins, and we'll be doing some more educational videos in the future. You can email us. The contact information should be on the screen at the end of this video. Thanks for watching.